We have a very well-rounded residency program, and our residents focus on medical derm clinics, also procedural clinics. We have a dedicated cosmetic clinic, and we also have residents spend time at Children's Hospital in pediatric dermatology. Luckily, they also get to spend time at multiple hospital systems, participating in inpatient consultative care.
We work through our safety net hospitals, and so our residents get a wide breadth of exposure to different disease states, in very poor and underrepresented people to very well-off people. So we have a very diverse patient population. We have a very diverse disease population. So it allows residents to see kind of diseases in all states and be able to learn how to manage them effectively.
We're one of the biggest CTCL clinics in the country. So we see tons and tons of CTCL here, and Dr. Boh is one of the world experts in CTCL, so we get to train under her.
One of the big things that drew me to the program was how many patients they see with hair disorders.
We're in a place that's like an urban city, but people are coming from all over. You have a draw-in from Mississippi, you have a draw-in from certain parts of Texas, certainly.
We see patients of all skin tones, which is very valuable when you're training in dermatology. So we see patients who are high risk for skin cancer, but we also see people who have other concerns, maybe alopecias, maybe concerns regarding skin pigment. And so you really get a chance to focus and learn and excel in all those aspects of dermatologic care.
We are encouraged to find things that we just didn't know about on a daily basis, and then we use that as a basis of continuing our education.
We practice something called graduated autonomy. So during your first year, we go to clinic and we see patients. A lot of times we see the patients on our own, and then we talk to the attendings about our plan. Kind of as you get more knowledge and get further along in your training, you're allowed to check out patients on your own, and you get more autonomy with the treatment plans.
We have wonderful, wonderful faculty who are dedicated educators.
There's no faculty member that I wouldn't feel comfortable talking to, asking questions.
35 years after being in practice, I'll still get texts from former residents who say, "Dr. Boh, I have this patient. What do you think of that?" And so that tells me they're always learning, but they're always coming back to where they came from.
I tell this to like all my friends all the time. I think we're gonna come out to be such excellent clinicians, and I feel really lucky that I get to train under such like amazing mentors.
There's a huge sense of camaraderie in this program. And a lot of people aren't from here, so that makes it even better because we get residents from all around the country. Just that base here is such a nice foundation to have if you're coming to a city and don't really know anybody.
There's so many opportunities to do so many things. People are always hanging out. Everybody's always together. There are several times where people get together multiple times in the day outside of work. And there's always stuff going on in New Orleans, and so that's one of the more beautiful parts.
Everyone's so welcoming. We hang out literally all the time. There's always a festival going on in New Orleans, so I did my first Mardi Gras this year, and that was fun to see, and all the residents are just like hanging out all the time.
When we're looking at applicants, what we look for is a commitment to underserved populations. We also look for people who are team players, who are hard workers, who are going to go the extra mile for our patients.
We love people who are curious, who see a rash, don't want to give up. They're motivated by a challenge instead of turned off by it.
Tulane, for its 135 plus years of history, has been about community, research, education, and patient care. And so those are the things that we want to keep in the forefront no matter what we do. And I think that we as a university and us as a department do exactly that.